Hey, welcome to another episode of Your Faith and Health Community. I'm your host, Pastor Jackie Jackson. And as always, on behalf of myself and our producer, Anita Alexander, we want to thank you very much for taking out time from your day to spend with us. And hopefully, we'll give you some information that will improve your quality of life. In fact, I'm positive we'll give you some information that will improve your quality of life. But before we jump into it, you know where I'm going. I'm going to talk about healthcare. Let me ask a question. How many people since the last time you saw this beautiful face of mine have enrolled in healthcare if you did not have healthcare, whether that's marketplace insurance because you fit the criteria for a change of life type thing? Not a change of life. That is not it. But you fit the criteria because you had recently gotten married, divorced, had a baby, started a new job, lost a job, just recently moved into the state, or recently came home from a correctional institution. Go on, I'll wait. I'm not going to wait. Listen, if you haven't done it, it's time to do it. If you've had a life-changing event, you have 60 days from that life-changing event to enroll in healthcare. You don't have to wait until open enrollment in November. If you are single and your income is less than $16,223 a year, that makes you eligible for Medicaid. If you are a family of four and your income combined is $44,500, that makes your entire family eligible for Medicaid. That's medical, dental, vision, prescriptions, the whole shebang. So there's no reason for you not to have health care. And if you don't want to do it for yourself, do it for the people that you love. Do it for your children and your wife or your husband so that you don't leave some astronomical medical bills if God decides it's your time, right? Just be real. That's why you have to have it, okay? I'm gonna get off my soapbox. I'm gonna put it aside because we have back with us Valerie Dow, who is a member of the City of Cincinnati Department of Human Relations Community Outreach Advocates, which we're better just known as the Community Outreach Advocates. And Valerie is a resource specialist. I've seen her do some things and work some stuff out, and I don't like the term magic, but I'm just going to use it. It's not a spiritual term. We just use that right here, right? Work her magic when she's out there dealing with individuals in the community. Thanks for being on the show again, Valerie.
Thank you.
Now we're going to talk. Last time you kind of touched a little bit about the resource process. Mm-hmm. Today we get a chance to do a deep dive about helping people with resources. And one of the things I want to start with, and we were talking about a few minutes ago, that there was a point where there was a lot more money or a lot more finances available to assist people with their resource needs. But now it's not as plentiful. Would that be true?
That is correct. And a lot of the reason is because of the economy and the cash flow into different organizations. And we were just talking about the availability of housing. So there used to be a time you could go anywhere and get a one-bedroom. Today, you be put on a waiting list, 2-3 year waiting list. You got to have an income.
A 2 or 3
years waiting list. Yes. Metropolitan housing, most low-income organizations have a waiting list for housing. As we start to look at, because one of the things that I do, I was formerly homeless and coming from that and, working with the Healthcare for the Homeless program for almost 10 years as an outreach worker and navigating the system and connecting people to the system is what I did then and it's what I'm doing now is housing is on the decline for low income. So they're just changing the language from low income to affordable. So what used to be $25 a month now may be $350 to $400 a month. And people are having to put their share in. I had the opportunity to be in Washington, D.C. a couple years ago, and one of the things that the federal government was talking about was the definition and the understanding of low-income housing. It was really designed to be a hand up, not a handout. And what they wanted to do with that was until you get up on your feet, not until the day you die. So now we're beginning to see the new rollout of that.
So they're going to, so does that mean that, because I've said so about 100 times, so let me get this together.
It's a lot.
The housing was really meant to be temporary housing.
Yes.
It was never meant, so, and we all know someone who has lived in public housing maybe 30 years. And so it was never meant for you to, it was never meant to call it home. It was meant to call it a waiting area or your next step. It's supposed to be your next movement. You said low-income housing is on the incline.
Yes.
So meaning that we're going to see less and less houses that are available for lower income. Is that what you're saying?
For people on fixed income.
Is that in the city or just across the board?
That's going from state to state. You know, I've been, last year I went to LA, and because I wanted to see what the tent city looked like, and it was overwhelming, and that was lack of housing, affordable housing. Everything that is going on here, I went to Boston, I went to Washington, I went to Chicago. It's happening everywhere. So it's not just happening here in Cincinnati. There used to be a time you could go to this organization and get assistance with your gas and electric. Now you have to go through one organization, you have to get on a waiting list, you got to wait until they call you back, and it's a lot. It's overwhelming because I think about people who have worked all their life, and based on their medical condition or whatever, they're not able to keep up with the gas and electric like they used to, because everything is on the rise. You know, you look at a loaf of bread almost $4, you know, and so that money isn't there. And the money isn't there when you talk about resources anymore. You know, you could go to Free Store Food Bank, Our Daily Bread, get a voucher, go get your birth certificate. Birth certificates cost $22 now. So now they just got one location where you could go and just get a birth certificate, and well, get the voucher to get one. So depending on where you live at, what is your income, what is your situation, is how they are assessing the needs of individual. And also, when was the last time that you visited that organization to get your needs met? And helping an individual just with rent, I found it's overwhelming. They won't help you unless you could prove you could pay the following month rent. So if you don't have an income, you can't get no assistance. If you don't have an income with the gas, for the gas and electric, to prove that you're going to pay it the following month, don't nobody want to help you. So, you know, there's a lot of things that and changes that are going on around the social service needs in the city of Cincinnati.
Well, okay, so now I have like about a ton of questions that have come up through this, so I'm trying to think where to go. And I want to go with this one first. I've always heard And, through ministry, from a pastoral standpoint, outreach is kind of my thing. That's the part that I love. And there's always been a saying about Cincinnati that Cincinnati is rich in resources. Are we beginning to see some of that richness dwindle here?
I think we're beginning to see a decline in the funding towards the organization.
And without the funding,
because
for every resource that's available, it may not cost me anything to get the resource, but as they say, there's no such thing as a free lunch. So even if I'm getting that resource and it may not cost me a penny, there's still funding that has to support that resource.
Yes.
So Cincinnati, which is, let's say 5 years ago, and maybe not that far back, if you lived in Cincinnati, there were resources on top of resources to cover the resources, right? But now you're saying that that is starting to shrink. So whereas it was as plentiful as it was, that's changing.
It's changing.
Which is going to affect those that are in need, because at the end of the day, people in need are going to always be around. And just because you may be living, as they used to say, high on the hog now, it doesn't mean that next year you can't be a person in need. And there are a lot of people that are one paycheck away from being that person, right? So another question I want to ask is this: because of the decline or the dwindling of resources, how is that affecting you in doing your job? Because like I said, I've seen you do it, so I see the passion, I see you work, and you'll pound and kick a door, and until you get that door open, or if you didn't get it open, it wasn't because you didn't try. But how is this decline? How is this the funding going away, and then the change in not just in the resources, but how they're even disseminated? How is that affecting the work?
I don't think it's affecting my work, but what I see is I had an individual stop me as soon as I got out of my car this morning. He's a veteran, and I had referred him about a year ago for some services. I meet people at their level of willingness. I don't turn nobody away. If you choose not to go, the door is always open to come back, and I'm going to redirect you. So today I walked him to the place that I told him to go. So we went, and he told me thank you. And that's that warm handoff that I talk about. It's one thing to refer somebody, and it's another thing to assist somebody. And I do a lot of footwork. Or either I take the person there to meet with whoever it is that they need to meet with. Because when you're homeless or when you're just in that state and you need assistance, you don't want to have to go through, of course, everywhere you go, you're going to have to fill out paperwork. But still, you don't want to go through that, sit right here and I'll call you. I got 10 people ahead of you. Sometimes you need that instant assistance or something to just give you some hope. That's what I call it.
Okay.
I call it hope. But you said something about me, and one of the things in the community and that people know about me, I'm going to keep going, keep going, keep going. They be like, oh, God, here comes Valerie. Because someone have to advocate for their clients, and that's what it's all about, advocating for their needs.
So let me ask you this. Can you take us through you must know what I'm getting ready to ask you, a start to finish? I mean, it's hypothetical, or you can use, I guess, an example. Obviously, we're not going to say who, but a start to finish process for a multiple resource situation. It's one thing, maybe I just need food, or maybe it's medical, or maybe it's just housing, because there are, and believe it or not, there are people who work every day. When we think about people needing housing, we usually just think that it's someone with no income, but there are people who go to work 8 hours a day, 40 days a week, and they're still having an issue getting housing. So take us through a scenario with multiple resources. I mean, just kind of a quick from beginning to end.
So two things came to mind. I was working with this lady. She was referred to me. She was a stay-home mom, and the dad worked. They had a home. He got diagnosed with cancer. And she called me because he was off work for like 2 months. So now they're doing unemployment or disability, but it's not meeting the needs of the household. So the only thing she needed was half of the rent paid and half of the gas and electric bill paid. And she didn't have a clue what resources could assist her. So I did connect her with a couple organizations who met her need. Sadly to say, her husband passed due to the prostate cancer. You know, that is just one situation. Another one, I got a call on my way here, one of my clients. Today.
Okay.
He's been shot 8 times. So he's been in a wheelchair for about 6 years. And what I like about him is his willingness to keep going in spite of. He wants to walk again. He didn't want to address the mental illness. So I've been working with him for 3 years. And every year is getting better and better. So he wants me to meet his new mental health case manager. So that was a good thing. And then we're going to start working on the housing piece, you know, because he's wheelchair bound and he just give up a lot of times. And when he get frustrated, he'll call me. So today was a good day for him. A lot of clients that I see, they have multiple needs. There's a healthcare for the homeless program, and it's a one-stop shop. I look at it like that. I used to work there. But they could get all their needs met, from mental health, medical, addiction. You talk about health insurance, which is very important, and dental. It's a one-stop shop. So most of my clients, that's where I refer them to.
Yeah, actually, that's where it took me up there, right? To go, let me ask you this. What problems do you encounter working with people? And I don't mean this to be a dig, but just if somebody's listening that are watching that may need resources and they may come in contact with you or anybody, it's just kind of almost a what not to do type thing, you know, because I know sometimes people come in, I want this and I need that, and then if you can't make it go, then it's right. So what not to do, or what issues do you find?
Don't make no promises. Don't make any promises, and don't make a plan for them.
Now,
it's the client responsibility to tell you what their needs are. I don't want to sit down with a client, and I learned this the hard way, is to tell a client, this is what I think you need to do. I think you need to go to treatment, and then you need to do this, and you need to do that. No. Let the client talk about what it is that they want, because then the responsibility is theirs, it's not yours.
Oh, so if I say, I think you ought to do this, and then you're not doing it, it's kind of like, well, but you're the one who told me to do this, right?
Yeah.
So it's not that I said I wanted that.
Yeah.
You wanted it.
Yeah.
So, okay, all right. What else? What else?
Just be careful when working with clients. You got to know them, or you got to know them to the point where certain things could trigger certain clients. So if you know the population that you're working with, you know how to deal with them. Know your people.
Okay, so let me see. I had another one that I thought was really good. Are you seeing that, and I don't even know if this is the right question to ask you, but in your capacity, are you seeing that people aren't using the resources as much as they probably should?
People are using the resources, but, and this is my personal take on it, a lot of the resources are being utilized for people without housing. And then, I mean, to me, Cincinnati is resource rich. There's
but
not
on a decline. Which is what we
even though it's on a decline, they could eat good every day.
But this is true.
I mean, you know, we work in an area where there's 1, 2, 3 soup kitchens. Then there's a shower house. So, and that's pretty good. You know, had an opportunity to meet a guy from Cleveland. He had came down to visit some of the resources in Cincinnati, and he was talking about it was resource rich as well. So overall, we're doing good. We're making contact with the people through the outreach piece that we do up in Price Hill, Western Hill. We're making contact with people. We're providing information where they could get resources, even in their community.
Okay, so and I'm glad. Okay, I'm glad you mentioned that when we're talking communities. So we're based in Over the Rhine, and so like you said, there are a lot of places right around our office. But let's move into areas like Price Hill. How's that looking as far as resources? Because if you're homeless or you're in that situation in Over the Rhine, then you've got some things that are right around your door or close to you. But let's say you're out in Price Hill. I'm not talking about down Lower Price Hill over by State Street. I mean, you're out in Price Hill. What are we looking at resources? Are they available there as well, or do you have to come into the inner city?
For Price Hill, District 3 is one of the biggest districts that there is.
It is the biggest.
And that's why they have you and I to cover District 3. And for us, the resources, of course, you got the Santa Maria, you have Block Ministry, and you have Salvation Army. But as far as resources like Over the Rhine, no, it's not there. And one of the things that I do, once a week I get about 50 bag lunches, and I'll go up in Price Hill and pass them out to various people, or go over in Westwood and pass it out. And I think one of the things that you and I had talked about as well, next month, putting on a resource fair up in Price Hill to service that area, see what resources we could bring to Price Hill. So
it does make a difference in what part of the city you're in.
Yes.
But even regardless, if you're in Price Hill or you're in Westwood or Fairmount or Walnut Hills or wherever, you can always come down.
Right.
Because at the end of the day, you almost have to come into the city, right, for certain resources to get that. With the change, let's talk about Over the Rhine for a minute. With the change in Over the Rhine, and we slowly see, well, not as slow anymore, that change from Over the Rhine yesterday to Over the Rhine today. But there's still a need. There's still a pretty strong need in Over the Rhine. Do you think that some of the decline in resources in Over the Rhine is because of the flip of that community? And whether people like it or not, Over the Rhine is flipping.
Has flipped.
Yeah, you're right, it has flipped. Yeah. So that would be but I don't think at the end of the day, you're not going to get rid of everybody in Over the Rhine that may need these resources, but do you because you're working in this a lot more than I am in terms of resource part with work, that they're moving a lot of those resources that are based in Over the Rhine out to other areas, or are they going to stay in Over the Rhine? Do you
They're
think?
going to stay. They're going to stay. They could change some things, but they can't change everything.
Well, I mean, like we know they moved the drop-in center down on, is that Guest Street? That's not.
Yes.
Is it Guest Street? And they moved. What was it on Magnolia and Elm Street? Gospel.
City Gospel.
City Gospel.
Mission.
They've moved City Gospel. So they are.
But those are
moving.
shelters.
Those are shelters.
Those are shelters. So what they have done was move the shelters out, but they haven't moved the services.
Okay, so
so
the
if you look
services
at the
don't stay there.
services, you're talking about Free Store Food Bank. You're talking about.
And you don't think you think Free Store Food
Yeah,
Bank will maintain
I
their
think-
location? Even and the reason why I'm asking because and this isn't, I know this isn't your field, so we kind of going away from it a little bit, but it's hitting in my mind, like the more the Over the Rhine flips, the more it changes. Like and it's not a lot of people think it's a Cincinnati thing. That is across the country
Yes,
thing.
it
When I lived in
is.
New York,
Yes.
I left New York in 2002, and Harlem had started flipping. You know, we had Disney. Well, we didn't have Disney yet, but we did have Old Navy and a whole bunch of other things that were coming on. So it was flipping. So do you think that once Over the Rhine really gets that into that gear that they're going for, that they're going to want the Free Store on Liberty?
No, I don't think so, because one of the things that the Free Store Food Bank does is not just service the Cincinnati area. The Free Store service Cincinnati, Indiana, and Kentucky. So if a person living in Indiana need food, they could come to the Free Store Food Bank. and
So
get
it's
food.
not just Cincinnati.
It's just not
It's
Cincinnati.
Not Cincinnati.
Yeah.
Okay, and so that's why I think it's good to having you talk about resources and even the work that you do. And I think that because sometimes when it's something that's our job, right? And so
Yeah.
that's your job. A lot of times maybe people forget the work that you, even though it's your job, it's still what you have to put it in. There are some people that they do just that. I'm just going to do my job. And it's 5 o'clock or it's 6 o'clock and my job is over. And I know you for a fact, you're out in the community, you know, it could be 7 o'clock, it could be 10 o'clock at night. And if you run into somebody, even if you're not going to, you can't go and do the work right then, you're already processing in your mind what needs to be done and giving them the information. So I thought it was important as a community outreach, as a member of the community outreach advocates, to also take an opportunity to thank you for the work that you're doing. And you're not looking for praise, and I get that, but the Bible says give honor where honor is due. And so since my 2.5 years of working with the outreach team, I've had the opportunity to watch you over and over really push and dig and scrape and sometimes go way above and beyond.
Yeah.
And that's a good thing, because some people won't, but to go way above and beyond what somebody might expect you to do to try to make sure that somebody could get some resources or somebody can get a peace of mind. You know, because I go home every night, I turn a key and open my door and I unlock it and I go in my refrigerator. And not to be able to do that, it hurts. For someone. You know, to God be the glory, I've never been homeless, but I can imagine, you know, I'm not so far, my mind is so far removed that I can't begin to understand or at least get an idea of working with individual, what it's like. So I appreciate you. I believe God's blessing you for it. And you became just recently, if I could say this was all right, right now, you grandmother has become mom all over again, and you got your 3 grandchildren with you.
Yes.
And doing all of this work. Listen, I want to thank Valerie Dow again, who is the District 3 South coordinator for the community outreach advocates. But the biggest thing that when I think about her more so than the District 3 coordinator is I think of her as the resource queen of helping people find what they need to help improve their quality of life. Hey, look, as always, stay faithful, stay healthy.